Hello, my name is Tanisha Jefferson. I chose to do my topic on health literacy. I chose to do my topic on health literacy because at some point in our lives, we all need to be able to find, understand, and use health information and services. So, what is health literacy? Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Now, limited health literacy affects people of all ages, races, incomes, and education levels. So, anyone, even a physician at times, can have low health literacy. It's just basically knowing new healthcare information that you haven't heard before. It's new to you. That goes into my thesis. Although people with low health literacy are overwhelmed by healthcare, we need healthcare in everyday life to prevent health problems, protect our health, as well as better manage those problems and unexpected situations that can happen. Healthcare or not healthcare, but health can change instantly. It's always changing, so it's important that we understand regardless of our health literacy status, which goes into why it's important. Health literacy is a fundamental to healthcare that requires individuals to have a more active role in decisions and management. So we have to be able to make health decisions and manage those decisions based on the information given to us by a physician. People with below or basic literacy skills are likely to have difficulty understanding health information, like prescription labels. Some people are able to understand like how many times a day to take it, how much to take. So they just basically try to go off memory, which isn't always good. People can overdose. There's health history forms. People don't understand the questions and sometimes don't even fill things out and just mark some of the check marks because they don't understand what they're reading. Self care instructions to help manage like a wound, apply how much again back to the prescription labels, and then wellness information to help us prevent from being ill. Some people again don't have the reading levels to be able to read and understand how to prevent themselves from getting any illness. So it's important that organizations try to make sure there's training incorporated in things to help us properly relay information to patients being healthcare providers, um, which goes into knowing your audience. Your audience could be a child where their reading levels aren't very high, so we need to be able to give them lower uh, lower reading information or explain to them in lower terms. Like when speaking with a child, instead of saying nasal congestion, you would want to say something like stuffy nose or runny nose so they can understand what you're trying to relate to them. Then there's cultural differences where we sometimes may not understand each other just with our words. So we may need to sometimes bring in an interpreter or translator to help us understand and get information to those with cultural or language barriers. Also, individual learning styles. Some people learn better with seeing things. So, like to an elderly person, you could present them with a chart telling them when to take their medication, the name of it, what time, which may help them know when to take their medication instead of you just telling them and them trying to remember. You also may want to use common words and consistent terms. Like I said, with the children, using runny nose instead of nasal congestion because someone may not understand that. Someone even older, like 65, may not understand some of the healthcare jargon compared to common words. You also want to speak in ways people can understand. Also, with the elderly, you may want to speak a little slower instead of speaking really fast because some of them may have hearing problems. So it's just knowing your audience and adapting to them to helping them learn what they need to do. Find multiple ways for people to learn. Um, then those low health literacy impacts everyone differently. Um, Individuals with limited health literacy reported poor health statuses and were less likely to use preventative care. So people with lower health literacy aren't getting the care that they need because they're not able to understand. So individuals with low health literacy are more likely to be hospitalized and have bad disease outcomes. They're more likely to use healthcare services, visits, and longer stays. Have higher mortality rates, especially for cardiovascular disease, and are more likely to engage in unsafe or inappropriate use of prescription or over the counter medications. As I mentioned, they're not able to read the prescription labels. So, what can we do to help improve those health literacy? If public and private organizations make it a priority to become healthcare literate, the nation's health literacy can be advanced to the point at which it will play a major role in improving healthcare and health for all Americans. So I just think that we need to incorporate more health literate courses to help us relay to those patients. The more we're not relaying, the more they're not understanding, the more we're having low health literacy rates. We just need to bring those up. And bringing those up can also bring down the cost of healthcare because now that they understand, they're not doing those visits more, they're not having longer stays. So things like that can really just help us improve healthcare altogether. So that's my presentation. I hope you enjoyed it. Thanks.